Welcome back to the Medigap Show. I'm your host, Holly Cohen, founder of MedigapCares.org. We're licensed in 40 states to help you throughout the country. Today, we have an urgent matter that we need to discuss that affects not only New York City retirees, but retirees across the nation. It's about a concerning trend where employer groups and unions are transitioning the retirees off of Original Medicare and onto a Medicare Advantage plan. This essentially means they are privatizing their Medicare. In a recent news segment by Spectrum News, they highlighted a big problem faced by the New York City retirees. But let me tell you, this issue is not exclusive just to the New York City retirees. Large and small corporations, as well as union members across the country, have been experiencing similar challenges over the past few years. Medicare Advantage plans, also known as Part C, shift a Medicare beneficiary off of Original Medicare and onto an HMO or a PPO network type of managed care or privatized Medicare plan called a Medicare Advantage plan. What this means for you, the Medicare beneficiary, is that Original Medicare no longer receives the bills from your doctors and hospitals. Instead, your doctors and hospitals bill directly to the private insurance company that has taken over your Medicare. Instead, those bills go to a for-profit, publicly traded insurance company. It's important to understand when you're on Original, or also called traditional Medicare, if your doctor deems something as medically necessary, Original Medicare must pay that bill at 80% without any questions asked. Your doctor, when you're on Original Medicare, has the freedom to do what's best for you. Let's watch this news segment now.
Welcome back to Inside City Hall. The Adams administration is moving forward with a plan to change healthcare insurance for many retired city employees. It means that the city would eliminate traditional Medicare as an option, making privatized Medicare Advantage plans the only option available. The city is set to move ahead with a deadline of June 30th for those who want to opt out. But the city is now facing a lawsuit from retirees who say that the Advantage plan will not allow them to see doctors that are not included in its narrower scope. Joining me now to talk through the issues here is Marianne Pizzitola, a retired FDNY worker who's also the president of the NYC Organization of Public Service Retirees. With me here in the studio is Jake Gardner, a lawyer leading that class action lawsuit to preserve retirement benefits. Thank you both for coming on the show. And Marianne, let me start with you. This has been brewing for a number of years now. The city attempted to do this before. What is different about the situation now from your point of view?
Well, the argument's basically still the same. Our organization is trying to push forward to protect retirees, both on litigation and legislation. The reason being is that we have been saying, which one of the major points that our unions are not listening, or media is not listening to, is that our benefits are being stripped away from us to enrich our former unions. I understand you spoke with Mr. Garrido last week, and he's insisting that this has to be done to us to save the city money. But this isn't going to save the city money, and it's actually going to cost us money. And as a correction too, you said June 30th was the opt-out or waive deadline. It's actually July 10th. And we're in the middle of litigation on that procedure right now. Privatizing our healthcare is the main purpose was this, when you talked about the stabilization fund with Mr. Garrido, was to enrich themselves. They took our funding to help finance their health insurance. And this was literally done on the backs of retirees, these wonderful people behind me. Tell me how selling them off in privatized healthcare plans where they would have additional costs is a benefit.
Okay,
it's not.
Let me bring Jake Gardner into this.
I think the one that's sort of easiest to wrap your head around is just an everyday person who doesn't have any background in the law, is that for a half a century, the city promised every single active worker and retiree, that when they became Medicare eligible, in other words, when they became elderly or disabled, they would be taken care of with city-funded Medicare plus Medicare supplemental insurance, which is far better than Medicare Advantage insurance.
You know, what you're talking about is that what they call Medigap? That there's Medicare and then the city would sort of supplement it in order to get you the full range of things that one might need?
Correct.
Is that the heart of the problem, Marianne, that there are lots of people who are going to find that the doctors that they're dealing with, even if they're not in New York, are not going to be part of this plan?
That's one of many, many problems. I think there's a lot of issues with this. The plan is a diminishment of our benefit. Many of our doctors are not going to accept it. Yes, there's prior authorizations, which we currently do not have now. Yes, there are additional costs. I know Mr. Garrido had said that the plan offers a $1,500 out-of-pocket cap. We don't need a cap right now. There are no expenses in our plan. So when we keep saying that this is not going to save us money or save the city money, this is actually going to harm retirees. We're not kidding, but no one wants to listen to that. And
Medicare Advantage plans have gained major popularity over the last few years for various financial and political reasons. It's so important to understand the implications. While Medicare does watch over Medicare Advantage plans, they have no direct involvement in the decision making when it comes to your healthcare treatments. It's up to that privatized health insurance carrier to decide if something is medically necessary or not if you're on a Medicare Advantage plan. You can watch all my other videos regarding the prior authorizations and what's been going on with those and Medicare Advantage plans. It's time to protect our Medicare beneficiaries. If you would, please like this video if you like it and subscribe to this channel so that we can get this message out and spread the word to ensure that all Medicare beneficiaries from now and into our future can continue to receive the care that they need. That's all for today's episode of the Medigap Show. I'm Holly Cohen, reminding you to advocate and do your research. You can always call us. We're able to help you, or find a trusted agent to help you navigate through the complex world of Medicare so that you are well informed to make the best healthcare decision for yourself. Thank you for watching, and I'll see you next time on the Medigap Show. Be well.